Hi, everybody. Today we're going to be talking about our home exercise guidelines. Once we get started in cardiac and pulmonary rehab, that's a really great start, whether you come in the 2 days a week or the 3 days a week. But we really want to talk about when you're feeling comfortable and ready, that we want to start adding in some exercise on some off days. So cardiac and pulmonary rehab is kind of meant to give you the tools to know how to safely push yourself when you exercise, how much you should be exercising, how often, how hard it should feel, so that you feel comfortable starting to add that in at home. So we'll just go through some of the really important components for an exercise routine. And with that starts a good warm-up. That warm-up period is really important. We want to safely ease our bodies into exercise. So just starting out nice and light. And we want to just kind of, ease that heart rate up and, slowly increase that blood pressure, kind of warm up our muscles and tendons and joints to reduce that risk of injury. So that warm-up period is really important. Usually, 5 minutes or so would be a good warm-up period. On the machines in cardiac and pulmonary rehab, feel free to start that intensity a little bit lighter, especially if we've progressed you to a good amount on your exercise prescription. You can always start a little bit on the lighter side. We also kind of consider that long hallway walk into cardiac or pulmonary rehab part of that warm-up period, but feel free to always just start out a little bit on the light side. That warm-up period also counts towards your total cardiovascular exercise recommendation. So what I mean by that is for heart health, they generally recommend at least 30 minutes of cardiovascular exercise most days per week. So on at least 5 days a week, we want to be getting that good heart healthy exercise, at least 30 minutes on those days. So that's where I was saying, if you're doing this that 2 or 3 days a week in class, that's a great start. We want to have a goal when you're feeling comfortable and ready of adding in those other few days a week on your off days. If you felt good, exercising and doing cardiovascular exercise 7 days a week, you could do that if you felt like you were recovered enough. But generally, those are those recommendations. That minimum guideline for heart health is to get at least 5 days a week, at least 30 minutes of cardiovascular exercise. You'll also sometimes hear that recommendation in getting at least 150 minutes a week. So whichever way is easier for you to remember. I usually like to say at least 5 days a week, at least 30 minutes, and that's kind of easier for me to remember, but whatever works better for you. So when we're talking about that cardiovascular exercise, that's that continuous rhythmic type of exercise like walking or riding on the recumbent bike or using a new step or swimming, that kind of thing. That continuous rhythmic movement is really what we're talking about when we recommend that cardiovascular exercise. So that's that cardiovascular or aerobic exercise period. And then we want to always cool down as well. So just like we want to ease our bodies into exercise, we also want to ease our bodies out of exercise. So doing a good cool down period, of about, up to 5 minutes for that too. And again, that warm up and cool down counts towards that total recommended duration of time. So if you're aiming for 30 minutes total that day, that those warm up and cool down periods count. And how hard should that feel? How hard should you feel like you're working is a common question we get. So hopefully, by going through the program in cardiac and pulmonary rehab, you're kind of getting familiar with how hard we want you working. If the staff is not, slowing you down because they're seeing arrhythmias or blood pressure issues or that kind of thing, that's about how hard we want you working. And you're basically trying to simulate that outside of class. So it should feel similar to what you're doing in the program. And as you get stronger and we're seeing all those vital signs responding appropriately, we'll gradually be bumping your intensity up in class, and you can progress right alongside of us outside in your home exercise routine. So that's kind of the goal there. So, one way to tell how hard you're working is by utilizing that rate of perceived exertion scale. You get very familiar with that in the cardiac and pulmonary program, where we're asking you how hard you feel like you're working. And that seems like kind of a simplified way of testing that, but really they've done a ton of research on that rate of perceived exertion scale, and it's pretty accurate. We usually are pretty good at knowing how hard we're working, and that kind of correlates to different vital signs that the staff is tracking. So, if you're rating your effort a 4 for, somewhat hard effort, but the staff are always having to slow you down because your heart rate's getting too high. At home, if you're feeling like you're working at a 4, that might be a good chance to slow down a little bit. That might be a little bit too much, but if you're rating it, moderate or so, and the staff doesn't come slow you down, they say you're doing great, then that's about how hard we want you working outside of the program, if that makes sense. Another way to tell if you're working too hard is by utilizing the talk test. And the talk test is great. You should kind of feel like you're able to speak a sentence when you're maybe walking with somebody or exercising. You shouldn't be gasping for breath. That would be more vigorous exercise. And you shouldn't be able to sing a song necessarily. If you're able to sing a song, you might want to pick up the pace a little bit. If you're gasping for breath, you might want to take it down a notch. So you should be able to speak a sentence while you're exercising. So kind of think about, maybe you're heading to the post office. It's about ready to close for the day. So you're working, but you're not, working so hard that you're out of breath. So that's rate of perceived exertion and the talk test. In cardiac rehab, we a lot of times don't assign you a target heart rate formula. With a lot of our cardiac rehab patients, they're on beta blockers, and this might apply to some in the pulmonary program as well, but beta blockers are those medications that end in OL, like metoprolol, carvedilol. Those are medications that lower your heart rate and lower your blood pressure so that your heart's not having to work as hard. So for you to try to get up into those target heart rate zones, like you might see posted at the gym and that kind of thing, that would be you'd be working too hard to get your heart rate up into that range, if that makes sense, because you're on those medications that keep that heart rate response down. So that's where we're mostly utilizing that rate of perceived exertion scale in class, especially if you are on those beta blocker medications. So feel free to reach out to staff if you have any questions on that or your medications. And then, of course, we always want to make sure that we're listening to our body for any signs and symptoms of overexertion. We like to go over these symptoms with you during that one-on-one visit, that initial evaluation. But it's just good to kind of refresh on these, that, while we're exercising, if we start to feel any discomfort or pressure in our chest, arms, jaw, back, neck, or, kind of radiating down that left side, especially if it was similar to any previous anginal symptoms you've had or heart event symptoms you've had, we always want you to slow down and not push through those symptoms and let the staff know about that in class. If you start to get nausea when you're exercising, we want you to slow down, obviously. And that goes for at home too. You shouldn't be, nauseous when you're exercising. If you start to get too short of breath, start to feel your heart rate really racing, get dizzy or lightheaded, or get the onset of a headache while you're exercising, those are good reasons to slow down. Any kind of paleness or cold sweats, we want to back off and slow down. So those are some symptoms to watch for. After exercise, we want you to feel pretty well recovered within about an hour. So if you go home and you're just pretty wiped out, we want you to let us know in class so that we can back off and maybe reduce your exercise prescription a little bit. Those are just signs that you're overexerting if you're still not feeling pretty recovered within that hour after exercise. So those are some general recommendations for home. Our staff will go over the strength training and stretching exercises with you on different days in class, but generally the recommendations for the strength training piece are to do 2 to 3 days per week on non-consecutive days. We aim for generally about 10 to 15 repetitions and progress to doing about 2 to 3 sets or times through those exercises. And so we'll go into more detail on those exercises in the classes, but those are just a refresher on the general recommendations. And then just lastly, I wanted to touch on weather considerations. So we usually say in those extreme temperatures where, locally here, we do get a lot of those temperatures where it might be above 85 degrees or under 45 degrees. Those are kind of the cutoff points we usually use. Those would be situations where you want to try to exercise safely, either, in the morning before it gets too hot, or during a time of day that those weather temperatures are a little bit more appropriate, or maybe indoors on those days where we get those extreme temperatures. So kind of having an indoor option might be nice also. If you do need to be outside, just make sure you're backing off on your intensity with exercise a little bit, or if you're just doing project work, those days, your body's already kind of working in overdrive a little bit to try to maintain your core temperature. So those would be days where you don't want to also on top of that push yourself too much. So, staying well hydrated, whether that's in the winter months or summer months, really all year round, we want to be drinking plenty of water, dressing appropriately in layers so that you're helping your body maintain its core temperature. Maybe you shed some layers as needed, kind of thing. So those are usually the recommendations for those extreme temperatures, having that indoor option. Let's see, those are kind of the main things I wanted to touch on as far as home exercise recommendations. Stretching is also going to be an important part of a home exercise routine, where we generally want to stretch daily, preferably after we're done exercising, where those muscles are nice and warmed up. We want to progress towards holding those stretches for at least 30 seconds. The staff is going to show you those exercises throughout your time in cardiac or pulmonary rehab, but those stretches are important to reduce that risk of injury. And generally our muscles like to stretch when they're nice and warm, so we want to usually do that after we're done with our strength training or our cardiovascular exercise. All right, thank you guys.